All right, this is Josh Halls for MSN 572 doing a musculoskeletal exam on Jessica. We're going to ask Jessica's consent to post this video to YouTube and so the teacher can see.
That's fine.
Okay, I'm going to walk in the room and get started. Hey Jessica, I'm going to wash my hands. My name is Josh. I'm going to be your nurse practitioner. It's going to be do your musculoskeletal exam. Before we get started, I just like to ask, I just like to ask if you have any musculoskeletal issues, any aches, pains, joint problems, anything like that.
No.
Okay, perfect. We're just going to get started here. I'm going to start with your wrist. The first things that I want to do is just look at your wrist here. I'm looking for any deformities, any nodules, anything that would be out of the ordinary that is poking out. And so the next thing we're going to do is palpate. We know the wrist, we've got those bones that are in there that make up the wrist. We just want to make sure there's no pains, no nodules, no deformities, no redness. Looking at the hands, fingers, joints as well. Again, looking for any redness, looking for deformities, nodules, things that might, lead us to what osteoarthritis or rheumatoid arthritis, things like that. And everything for Jessica looks to be normal. So now what we're going to do is do a range of motion. I'm going to have her hyperextend her hands, forward flex. We're going to move them to the ulnar and radial joints as she's moving her hands. Everything looks good, no pain, no issues. I'm going to do a Tinnels Test. I'm going to have you hyperextend like that. I'm going to tap the medial nerve. Are you having any pain running down that leg, that arm?
No.
About that side. And then there's also the Phalanx Test as well that you can test, where you just kind of do that same thing. You're going to hold them like that for a minute, come back up, hold that for a couple seconds. Let me know if you have any pain shooting through your arm.
No.
Okay, perfect. All right, moving to the elbow. Again, first we're going to inspect. We're going to look to see if anything is out of the ordinary. Okay, and everything with Jessica seems normal. Now we're going to palpate equally, filling the olecranon process, filling the ulnar and the radial down there. No pains. Okay, what I'm going to have you do is supinate those arms and then turn them over and then doing kind of a bicep motion there. Just make sure there's no pain in the joints, listening for crepitus, anything again that would be out of the ordinary for a joint. No pain, no issues, no redness, no deformities. Again, those are the things we're looking for with this. Okay, now we're going to move to the shoulders. Again, first we're going to inspect. Normally we would have the patient take their shirt off and inspect the shoulder, but we're just going to do some palpating of the scapula in the back, the shoulder, the clavicle and the joints of the clavicle. No pain, no issues,
No.
no tenderness.
No.
Perfect. Now what I'm going to have her do is range of motion, palpitation, nothing abnormal. I'm going to have you raise up your arms here and then go all the way up. We're going to come out and all the way down. Any pain or issues? And then one more, I'm going to have you reach all the way back there. Any pains or issues with that?
No.
Now what we're going to do is do an empty can study here, which just kind of helps us with rotator cuff and tendons like that. So what I'm going to have you do is about 45-degree angle, have you pouring out a can with your thumbs down. And I'm just going to lightly pull down any issues, any tenderness, any pain there. Perfect. And while we're up in the shoulder area, I'm also going to do the neck. Okay, we're first again going to inspect. We want to make sure there's no deformities, nothing out of the ordinary, no redness. Then I'm going to palpate just back here, the neck, any pain, tenderness, anything like that.
No.
Okay, so now range of motion, we're going to have her just turn her head to both sides. We're going to have her go chin to chest, head to back. Any pain or issues, any shooting pains down the back?
No.
Perfect. Okay, now we're going to move to the feet. Again, we're going to just always inspect first, then palpate, and then worry about your range of motion. I'm going to take off her socks here. Whoa, smelly. Just kidding. Okay, looking at the toes and the feet, no abnormalities, no redness, no tenderness, no deformities, nodules, bony growths that just look like they shouldn't be there. And also looking at the ankle at the same time while I'm inspecting. Ankle, looking at both lateral and medial malleoluses. And the malleoluses kind of protect our tendons that run down to the bottom side. So you can also check those, just making sure there's no tenderness or any lightning pain that would radiate down, causing, having some pain there in the tendons and nerves, which everything seems to be fine. So now what we're going to do is I'm going to have her flex her toes down, flex them up, and move her ankles all around, and also do your toes. Okay, and you can do the Babinski Reflex with adults, and it's normal to, when you see that, to have an opposite effect of the kids where the toes kind of curl under. With babies, they flare up. If it flares up with adults, it's a big issue. You can check both feet with that, which is very normal. Okay, then we're going to move to the knees. Again, just inspecting. She's wearing pants. Normally we would have them wear comfortable shorts or something that we could check, inspect, palpating both knees, feeling for any abnormalities, any joint issues. You'd be able to feel, again, you got a lot of tendons in that knee that we can do tests for. So now we're also palpating the back of the knee for that bursa sac that's in the knee, feeling for anything, any bulging, anything that would be a tenderness back there that would lead us to believe that there's major issues going on with the knee. Okay, so now what we're going to do is just some simple range of motion. I'm going to have her flex her legs up. Can you go higher than that? All the way up, any pain in the knees or tenderness? Okay. Now we're going to check both knees, checking both ligaments. So there's tests, I've forgotten the names, the valgus and the Fraus, where you're checking here. I'm going to keep her knee stable with my one hand and move the leg back and forth, making sure there's no pain. Again, the knee has 4 major tendons, the anterior, the ACL, PCL, and then your 2 on the medial and lateral sides that we just want to make sure are intact. Okay, and then I can keep my foot on her toe here. It's better to do this laying down, but sitting down you can still do that anterior drawer test where you're checking to make sure the ACL or anterior cruciate ligament is still intact. Here, twisting, as you keep the knee stable, moving the knee back and forth is testing for that medial and lateral ligaments. So we're going to check that drawer on both of them. Or we're just looking to see if that lower half of the leg comes out a lot further, which would mean our ACL is no longer intact for issues and injuries there. Okay, again, keeping that knee stable, moving the leg back and forth to make sure our ligaments are intact in the knee. Doing that drawer test and also pushing back in. The knee is a very fragile ligament, especially as we get older. So testing for those is very important because some people can have a tear and not even know they've teared because of what they do. Even sometimes stopping in a grocery store really quick can make that ACL really pop, but continually walking on it isn't a big deal for them until they come in and get checked. So it's a good thing to check. Okay, now we're going to check the hips. We would normally inspect both of them. I'm just going to palpate here, checking for any pain, redness, tenderness. And what I'm going to have the patient do while she's just sitting down here is I'm just going to have her move her legs out, move them back up, have them lift and move around. A full 180 movement there, just checking and listening for any crepitus, listening for any pops, and checking for any range of motion issues with the hips, which there doesn't seem to be any. Sorry, there's a tickle. Okay, so hips all seem to be normal range of motion, no deformities, no pain, no tenderness. Now we're going to check the spine. So we would again inspect. What I'm going to have to do is have the patient stand up and do the bend over, checking the spine here. And even if you don't have the patient take off their shirt, you can still feel for that spine, making sure there's no scoliosis, no curvature, kyphosis or lordosis. You can check with your hands, making sure that spine is all in normal. Okay, you can sit down now. And now again, palpitation, that's fine. There's feels to be no compression of the cervical, lumbar, or sacral bones, joints in the spine. Now what we're going to have the patient do is twist from side to side, making sure there's no pain and bending side to side. And we just saw her bend over, we're going to have her hyperextend a little bit, no pain or issues.
No.
Okay, perfect. That would be just a quick, brief musculoskeletal exam, checking all, inspecting for deformities, palpating for tenderness, and then checking for, our major ligaments and joints for any pains or issues, and checking that spine.
Thank you.
Thank you.